जी
अकरम भाई मैंने एयर वाटर सेक्शन चेक है, अगर दोबारा से करना चाहें तो कर
नहीं ठीक है, आपने चेक कर लिए तो बहुत है। अच्छा जी ठीक है। सो यू आर सपोज टू यूज़ मिनिमम ऑफ द एयर। अच्छा, जब भी आपने इंट्रोड्यूस करना हो, सबसे पहला काम पेशेंट पोजीशन हमेशा देखें।
ठीक है सर।
पेशेंट का नीचे वाला कंधा पीछे, ऊपर वाला कंधा आगे, हल्की सी एक्सटेंशन, सो दैट यू मे बी एबल टू इंट्रोड्यूस इट मोर इफेक्टिवली। नीचे वाली टांग सीधी ऐसे, ओके
और ऊपर वाली टांग को आगे कर
ओके, नाउ प्रोसीड।
थोड़ा सा।
So follow the anatomy of the tongue, right? थोड़ा सा आगे यहाँ से, ओके Okay, generally what I do is that I usually go to the EG junction first and stop there, and over there I enlarge the EUS image. So we are at the EG junction, we have started to see the left lobe of the liver. So once you've seen the left lobe of the liver, yes, EUS image. Now we can see the left lobe of the liver. So try to, now, are you happy with the left lobe of the liver?
ग्यास भाई आपकी आवाज़ नहीं आ रही बिल्कुल।
The prominent thing, this is the left lobe of the liver.
Gyas bhai, can you hear
right
me?
Next to the left of the liver, we have the IVC.
उनको भी नहीं आ
So
रही
once the left of the liver is there, turn slightly. अच्छा, दूसरी की position, stand back. Dr. Khalid had told you that when you're tall, you can stand right next to the patient. But once you are, if you're not tall, then in order to keep the endoscope straight, your movements have to be with the shoulder and rotation of your body, and not with the hands. So this is just to give support to the endoscope, nothing more than that. So your main movements have to be with the shoulder and with the hips like this. Okay, right. So clarify the liver better. जैसे पहले आपने liver दिखाया था. We need to see the liver more clearly.
आपकी आवाज़ नहीं आ रही।
आवाज़ आ रही है अब?
हाँ, अब आ रही है।
अच्छा ठीक है, I need to speak louder. मेरा नेक्स्ट एक कमेंट करूँ, नवीन शाह, उसकी सिस्टर भी आना है, मुझे ऑफिस में बता दें, तो आने को बिठा के बता दें, अब उसके बाद नवीन शाह को दिया है, मैं 3 दिन उससे कहा था, वो फिर नवीन साहब को कहीं इसका मैं ये ले लें, उसको फ़ोन करके पूछ लें। Okay, what do you see? Basically, it's liver?
Yes, sir.
Okay, once you've seen the liver, instead of going into the details of the structures at this stage, I think let's concentrate on the mega things. You have seen the liver. Now, once you've seen the liver, rotate to the right. In other words, clockwise rotation. Rotate yourself to the right. And what do we want to see? We want to focus on the aorta, right? So keep rotating, keep rotating, keep rotating. Now, we need to see we need to see a hypoechoic area with 2 lines straight parallel to each other and right next to the vertebrae. So where do we see that? Okay, we can pull back slightly. Right, we can see that here we have something which appears to be a blood vessel. We want to confirm it. Okay, if we want to confirm it, we can use the flow, right? So it's a big vessel. Now once we've done that, I think just relax your big wheel, just relax your big wheel, okay, and slide along to the, now yes, you see here we are able to see it in a better way. Now keep it under your transducer. Keep it under your transducer. Where is, okay, now keep it under your transducer, okay. Now slide gently along this black thing, and keep it under your transducer. You need to keep it under your transducer, push, and the first vessel which is arising from this, that is celiac artery. Okay. So once from the big aorta, once you've seen the celiac artery, follow celiac artery a little further, and you're going to land at the pancreas. So this is the pancreas. This is the pancreas. Now once you're at the pancreas, the whole attention should be at the pancreatic duct. Now bring the pancreatic duct right in the center, right under the center of your transducer. So little further push. Over here, this is the splenic vein, and this is the splenic artery. Now, forget about this splenic artery, splenic vein. Your main focus is this pancreatic artery. Around the pancreatic artery, you have a nice parenchyma, a nice tissue of the pancreatic parenchyma. Now, once here, big wheel up and slight rotation to the right, to the clockwise. Big wheel up, no, big wheel up
towards,
and rotation to the right. And you're going towards the tail, and right there, no, slow. I've already told you that in EUS, your nipples have to be in millimeters, not in centimeters. So they have to be very subtle, slow. Let me introduce, show you the different structures. Now, here we have the kidney, right? We have the tail of the pancreas. Here we have the spleen. In between, we are going to have this tail of the pancreas. So make it a little more clear, and here we have splenic artery. So just a little push and rotation, and you can see the pancreatic tail going in between the spleen and the kidney. And right here we can see that we have the adrenals as well. So this is the adrenal. Okay. Now turning back, big wheel slightly away from you, The pancreas is right underneath your transducer. So keep the duct right at the center of your transducer. Now go counterclockwise, slow, very slow, and big wheel again up, and you can see the dip of the, no, slow. You can see the pancreatic duct dipping down towards the head of the pancreas. So you need to be slow, and big tip up. Whenever you lost, again come back to the previous position. You see, you have got put lots of air in the stomach. Keep your this finger away. Suck all the air. You don't need any air in the stomach, right? So reflexly, if you're used to the black and white images, you're used to the routine endoscopy, you are bound to inject some air into the lumen. So that is not something that we need. If you're lost, again your position of the endoscope, your holding of the endoscope is like a routine endoscope. In EUS, we don't want it like this. Now, you are at the aorta, this is celiac artery. Go back and push a little further, big wheel away from you, and you can see that right here we have the pancreas. So bring the pancreas. Okay. Here we have the pancreatic duct right underneath your transducer. Once it's there, right? Now turn left, big wheel up, tip up, and keep rotating, and slight pull back. Slight pull back. Now you can see the pancreatic duct going down. This is the pancreatic duct going down, right? And right here we have the portal vein. So just a bit of practice. Again, I think you're injecting air. No air. You are not supposed to inject the air in the stomach. So suck back the air. Suck back. Don't inject the air. We always have a tendency to inject the air. So we need to learn not to inject the air. So keep sucking the air. So you have lost, so you need to come back to the previous position. A practice of this thing few times and you will be good with that. So again you are at the liver, right, at the aorta. Now once you are at the aorta, slide, keep the aorta underneath, slight push, identify the celiac takeoff, and right there you are at the tail of the pancreas. So pancreatic duct right underneath your transducer. Now we want to go towards the head region.
Okay, sir.
Avoid this thing.
Okay, sir.
Right. Now clockwise, counterclockwise, keep tip up, tip up, tip up, and slight pull back. And there you see the pancreatic duct coming down. This is the pancreas. This is coming down towards towards the head of the pancreas. So you need to keep it clear. You need to, again, I think you are injecting air. You're not supposed to inject the air. Every time you're going to inject the air, you're going to lose the image over there, right? So pancreatic duct is here. Do you think that this pancreatic duct is prominent? Maybe yes, maybe not, right?
Okay, sir.
So let's see. What do we see? We measure the pancreatic duct over here. Although I think over here it's not prominent, it's not dilated, but towards the head I expect that this is going to be a little more prominent. So it's 2.1. Standard is 3 to 1. So over here at this point, I think pancreatic duct is fine. Okay. So as regards this place, we are done with the examination that we are supposed to do. So do you want to repeat the maneuvers? Do you want to go towards the tail?
Yes, sir.
So let's go towards the tail once again. Identify the left of the liver. From the left of the liver, go to the aorta. From the aorta to the celiac artery. From the celiac artery to the pancreatic duct. And once you're there at the pancreatic duct, clockwise rotation with tip up and go towards the tail of the pancreas. You are supposed to go in the interval between the left kidney and the spleen. Okay, this is the left of the liver, right? Keep reading clockwise, rotation clockwise, 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 clockwise. There you have the aorta, right? Once you are there at the aorta, push the endoscope along the aorta. Now keep it along the okay. Now you see the take of the celiac artery.
Okay.
Now follow the celiac artery, and there you land at the body of the pancreas. Now this pancreatic duct is right underneath your transducer. Tip up and clockwise rotation. Tip up and clockwise rotation. Here we have the left kidney. Over here we are going to find the spleen. So okay, fair enough. Now you're likely to lose the, if you're not careful with your movements and you are not gentle with your movements, you're going to lose that. So you've lost the area. Once again go back to the previous structure. Okay.
This again a alpha.
This is the pancreatic duct.
Thank you.
ढीला, हाथ ढीला.
Sir.
अपनी बॉडी मूव करना सीखे. ये जो ना, हाँ, हाथों की मूवमेंट कम, बॉडी ज़्यादा. ओके, टिप अप एंड क्लॉकवाइज प्लीज. टिप अप एंड क्लॉकवाइज. टिप अप क्लॉकवाइज. ओके. हाँ, now you see slow, very slow. You see right here we have the left kidney. Over here we have the spleen. This is the pancreas. So forget about this at the moment. Concentrate on the pancreatic duct.
Okay, sir.
The central, this pancreatic duct, this needs to be kept underneath your transducer, under your view all the time, because this is going to guide you towards the area where you intend to go. Now this is the left kidney, this is the spleen, and in between your tail should go like this, and this is splenic artery. Okay. So again tip up and slight pull back. Tip up and slight pull back, and rotation to the right, clockwise. Okay, good. You see, we are able to trace it up till this point, and this is the pancreatic duct, right?
Okay, sir.
We can see the pancreatic duct in a much better way, but we are not able to see the tail beyond this particular point. Okay? Okay, now from this point, go back to this to the previous neutral position, where no previous neutral position, the point from where the point when you had started going towards the tail. So go back to the previous position, at the initial point, when you started to rotate to the clockwise. So go back,
Anti-clock.
not with the rotation of your fingers, rather with the rotation of your with your shoulders and your body. Okay, right. Now you go here. Okay. ये गई. This is, we are going down towards the head region. Okay. Some of your tendency to inject the air in the stomach. Okay, right. So now go to the next station. Next station is duodenal cap. At this stage, forget about all other maneuvers. Station 1, EG junction. Station 2, duodenal cap. So let's go to the duodenal cap. In the duodenal cap, we are going to go in the long position. So push your endoscope towards the duodenal cap. Don't inject too much of air. Don't inject too much of air. Just a little air, enough to give you the opportunity to see the pyloric opening. So push, pull back, push, pull back. This is going to align the pyloric opening with your endoscope. Okay. So push and pull back. Okay. Now place your transducer at the posterior wall, right? Right here, and suck. Now what do you see?
PD.
Forget. Okay, PD. But the first structure that you are supposed to see at this point is this particular thing, which is called the portal vein.
Portal vein.
Portal vein. This is splenic vein. This is superior mesenteric vein, right? The one which is closer to you is superior mesenteric. The one which is away from you, that is splenic vein. And this portal vein. This is the first structure that you are supposed to identify. Once you have identified the portal vein, next is CBD towards the liver counterclockwise, and portal vein, pancreatic duct clockwise, meaning back to the right. So tip up and clockwise rotation, you are going to go towards the pancreatic duct, and you will be able to identify pancreatic duct. So this may be the, slow. Again, your movements are in centimeters. It has to be in millimeters, right? So let's see, what do we have? What is this? This is some kind of duct. This is vessel. So this has to be most likely pancreatic duct. So how can you be sure that this is pancreatic duct? The only way that you can be sure that this pancreatic duct is by bringing the pancreatic duct under your transducer and tracing it to the right and to the left, right? So tip up, bring the pancreatic duct underneath your transducer. Now it's away from the vessel, right? Now at this junction, try to follow this this duct to the right and to the left, and we are sure that this is pancreatic parenchyma, right? We are sure that this is pancreatic parenchyma. So you need to follow to the right, to the left. Follow to the right. Forget about the portal vein now. You are concentrating on pancreatic duct now. So follow the pancreatic duct to the right and to the left. Right? This is one thing is sure that we are looking at the duct, and we can measure this as well. So this is 6.2 millimeters, so it's fairly dilated, right?
Okay, sir.
जी वापस हाँ okay. Now where's the duct? We are not able to see the duct very clearly, so you need to just like previously, you need to clarify the duct. Okay, right. Now follow to the right, follow to the left. Okay, trace. Go clockwise. We are going towards the body of the pancreas, neck of the pancreas. So it's dilated. So follow to the clockwise side, to the counterclockwise side. We are going towards the papilla side. Follow. And once we are at the papilla, we have a lymph node over here. Okay. Trace it further. We have multiple lymph nodes right here, and okay. Keep rotating counterclockwise. Keep rotating counterclockwise. Right. Okay, good. And we have multiple lymph nodes right here. Right? Okay. What is this? What is the most likely? What's this structure? This is CVD. Okay. CVD is baggy. So you have confirmed that this is CVD. Once now, forget about pancreatic duct. Now go towards the CVD. Keep the CVD underneath your transducer and follow to the right and to the left. This may be CVD, this may be gallbladder. So you have to differentiate whether it's CVD or it's gallbladder. Most likely this gallbladder. If you look at the shape now, this gallbladder, you've gone a bit too far further. So you need to pull back slightly. Okay, pull back, pull back. हो गया 15 मिनट? अच्छा चलो ठीक. Right. Are you injecting air?
No, sir.
Okay. So suck the air. Okay, you need to bring the, you see, your duct has to be underneath your transducer. So where's your duct? The duct that you are interested in. This is some kind of vessel. So this is not something that you are interested in. Okay. So go back to your previous place and try to identify the common bile duct. And this is the common bile duct, you see, over right at the top. This is the common bile duct. This is the gallbladder. So you need to come back slightly. Okay. Come back, come back, come back, come back. Tip up, and pull back. चलो दिखाओ अब इसको क्लोज करिए. Now what do we see? We have something in the lumen of the duct. Now this can be sludge, this may be the stent. So what do you think? If we see two parallel lines, then it's the stent. If we see just the, you see over here we have the two parallel lines. So this is most likely the stent over there. So we need to go back in. Right, we have something in the lumen. Clockwise, counterclockwise, and we have to identify whether this is gallbladder or this is CVD. So we need to go down towards the. You see, there we have those two parallel lines were because of the stent. Right. Okay. So long time back. Section चल रही. So next thing to do is to place your transducer right at the ampulla. Okay, once at the ampulla, we have got three things to look at: right kidney, IVC, and aorta. So first right kidney, then IVC, and then aorta. Once the aorta is there, we need to bring aorta here, and on the right side, we are going to find the head of the pancreas. And the head of the pancreas, we need to concentrate on two things: pancreatic duct as well as the bile duct, right? So
we return right now.
हाँ जी.
Clockwise.
Clockwise, right? You see your kidney आया. So slight pull further, and we can see that we are already at the pancreas. And we see that there we have the two parallel lines of the stent. Okay. ये pancreatic duct आई तो slight pull back over here. I don't see any hypoechoic area over here. I can see that the duct is dilated, but then I don't see any hypoechoic area at the junction of the two places. Although I've seen multiple lymph nodes over there. So right here, we don't see any hypoechoic area at this point. Maybe this particular place, this is something which is abnormal, but not definitely abnormal. You see, over here we have the two stents. This is the pancreatic duct which is prominent, and we have the stent. And stent is going through something right here. If you look at this this place, stent is going through some tissue area. I don't know what this tissue area is, but this is the place that we need to target, right? So let's take the biopsy from this particular place.
Biopsy, please.
Any question from the audience? Connected भी हैं कि नहीं? आवाज नहीं आ रही?
Dr. Yas,
Yes.
can you show us the exact ampulla, because we are unable to see that very
Well,
clearly and
the-
properly. We can see that the CBD wall is quite thickened.
Yeah, CBD wall is quite thickened, and there's a stent going through the CBD, and that's the reason that we are not able to make out the ampulla clearly. We can see the pancreatic duct quite dilated, and it's right here, and we see some tissue area in this region. So I'm not sure what are we dealing with. I don't see any clear-cut hypoechoic area, but this is the area that we can see. This is fine, but over here we have some kind of tissue. I can't call it abnormal right away on EUS image, but yes, there is something over here. I'm not sure where it is. So the only way that we can ascertain that this is abnormal is by taking a biopsy from here.
And can you comment on the lymph nodes?
Yes, there are multiple lymph nodes, but then they are not the classical lymph node of malignant nature. Yes, they are there. Now, what does the house think? Should I be doing biopsy here, or should I be doing biopsy from here?
I think this area.
This area.
Yes. Would you categorize this as a sinister lesion or just an inflammatory pseudomass?
I think it's
Can it
more.
be-
I shall put it down as an inflammatory lesion, not the malignant lesion, because the lymph nodes are of not that nature. With the presence of stent, I don't know whether it's a stent reaction or something different. I'm not very sure about the nature of this lesion. This is not clear-cut malignant in nature. That's what I'm sure about.
Dr. Gyas, how does the ampulla look endoscopically?
It's fine.
It's fine.
Okay. Okay.
सर बताइएगा बस
निकाल। एक हाथ चलने दे, दोनों हाथ ना चलाओ। चलो अच्छा, जनरली एक चीज़ है कि जहाँ पे डक ख़त्म हो रही है ना, प्रोमिनेंट डक, लीजन वहीं पे मिलेगा, बायोप्सी भी आपने वहीं पे लेना। दिस इज़ द एरिया दैट यू लाइक टू बायोप्सी, दिस एरिया, राइट? एंड इफ़ यू ट्रेस द स्टेंट here, you'll be able to see that, ठीक है, ये स्टेंट वाला एरिया है, यहीं पे आपने बायोप्सी करनी है, ठीक है, ये स्टेंट है, ये यहाँ पे, and this is something that we have over here, so we need to biopsy only this area, right? And your needle is going to come from here, from this point. Any comment from the hall? Are you with me?
Yeah, these are always challenging cases because you don't know how aggressive to be, and one of the risks we were discussing is potentially, causing damage to the pancreatic duct.
Yeah, I've intentionally tried to stay away from the pancreatic duct, and I've taken the biopsy parallel to the and close to the previously placed stent,
Yes.
because that's the place that I expect. If I find anything abnormal, I'm going to find abnormal at this particular area.
Yeah.
Can I have my needle, please? So millimeters,
Okay,
no
sir.
air.
यहाँ पे 2 स्टेशन D1 and D2.
I'm in D2 now.
Okay, sir.
D2 में यहाँ पे आपकी आएगी ducts. D1 में CVD here, pancreatic duct here, and port vein in between. यहाँ पे vessels on this side. You see, aorta जो ना ये side पे आ रही है, ये aorta है. जी? क्या?
कह रहे हैं सैंपल सही है।
अच्छा, ये उसमें ना स्टेरॉइड डाल दें
स्टाइलेड।
और उसके ना उसके साथ मुझे स्लो उसके पुल के साथ चलने दें। टेक्निक वो चलो,
फुल टेक्निक।
दरमियान में ना वो पैरेलल ना कर।
ये तो सही है।
ठीक। चलो ठीक। अब मुझे ना अपने तरीके से करना, ठीक। होल्ड प्लीज।
होल्ड ऑन।
अब ऐसे से पुल करके एक मिनट। होल्ड बेटा, यहाँ पे एंडोस्कोप को होल्ड करो। हाँ, होल्ड करते जाओ। हाँ, ये मैं स्टैंड को हिट करो। चलो जी खींच लो सारा। इसके साथ देखें, होपफुली ये सफ़ा आना चाहिए, क्योंकि इस दफ़ा ना मुझे फील भी कटेंगी थी
कैप लगाइए
जी।
मैं कह रहा हूँ कैप लगाइए
वो ठीक है आपकी, कैप की कोई टेंशन नहीं होती क्योंकि हमने एयर तो इंजेक्ट करनी नहीं, और एयर वैसे भी अंदर से निकल भी आएगी तो क्या क़यामत है। हाँ, तो हमें एयर का कोई टेंशन नहीं है, अलबत्ता अपनी पोजीशन हमने मेंटेन करनी है। ठीक है, ये हमारा जो मेन स्ट्रक्चर है वो है पेंक्रेटिक डक्ट। पेंक्रेटिक डक्ट के इस साइड पे हमारा जो है दिस इज़ आवर एरिया ऑफ इंटरेस्ट, ये स्टैंड नजर आ रहा है। ओके, अच्छा पेंक्रेटिक डक्ट को आपने अवॉइड करना है। पेंक्रेटिक डक्ट आपकी फिर पेंक्रेटाइटिस का रिस्क होता है।
Gyas bhai, you are gonna move on to the next case,
ओके फाइन,
and I think when you are done, you can finish it.
ओके वी आर डन फ्रॉम हियर, थैंक यू वेरी मच।
Thank
प्लीज
you.
मूव टू द न्यू केस।
बायोप्सी आ गई है देखिए बताएं
ये बंद कर दें।
अकरम भाई बायोप्सी हो गई
देखो मैं हाथ यहाँ पे नहीं रख रहा,
जी सर
ठीक है, मेरा जितना भी है इसके साथ ही। चलो किसी दिन और सैंपल ले लेंगे।
अगर आप